name is Michael Karch. I'm an orthopedic surgeon practicing in Mammoth Lakes, California. I specialize in robotic and computer navigated surgery, but also in international disaster medicine. I volunteered with International Medical Corps in 2015 for the Nepal earthquake. In my early years, I was always working and using my hands, especially working on small farms. But at the same time, I had this desire to help people. My interest in medicine really started early. And it really was driven by a desire to help other people and to fix things. And so I think I was driven from a very young age to do that. I was always intrigued by surgery and how we could use our hands to fix and help other people. And so I think that's really where I got my start in medicine. And medicine, but specifically orthopedic surgery, really is that perfect combination of using your hands to fix things and to innovate and at the same time help people. So the morning of September 11th, 2001 was an awakening. I went home, I packed a backpack with some emergency supplies. I jumped in a cab and took a cab from Washington, D.C. To Baltimore because all the trains were shut down. I caught the last train from Baltimore to New York and ended up setting up the first MASH center at Ground Zero. Ground Zero was like nothing I had ever seen. It was hot. It was incredibly dusty. You couldn't breathe. It was suffocating. There was just mass destruction everywhere, exploding gas lines, electrical lines that were alive. It was a very, very dangerous situation. There was no order. There was no leadership. There was no set of rules or protocols. We literally had to make them up on the ground. And that was very difficult, but at the same time, I think people just rise to the challenge. And what I saw at Ground Zero was one of the worst events in our history. But what I also saw was some of the best human efforts, probably in our history as well. The firemen, the medics, the physicians, the nurses, the steel workers were just operating at an incredible level of expertise. That was a real awakening for me. And I really spent the next probably 10 years studying mass casualty medicine, studying everything that was going on in the Iraqi and Afghanistan wars and what we were learning over there, and really just focused in on how to most effectively treat a large number of patients that are exposed to a bomb or a disaster or any such event. Disaster medicine and disaster relief is pure medicine. I think it's why all of us in the healthcare professions went into it in the first place. I arrived in Nepal in 2015, just after the earthquake hit, maybe 24, 30 hours after. And we flew out towards the Annapurna region where we were working. And our mission at that point was strictly reconnaissance. Just to find out, what villages were damaged and to land very quickly and get home before it was dark. I was sitting in the co-pilot seat with the pilot, and behind me were two young Nepalese girls, probably 15, 16 at tops. And they were both singing and crying at the same time. So I could talk to the pilot and I said to him, why are they singing? And his response was to hold back their tears. And I asked the next logical question, which was, well, why are they crying? And his response was, they've lost everything. Well, why are they here? And his response was really profound. And it really kind of served the base of the book, Tangible Heroes, which I wrote. And he said, it's now their purpose. He said, the earthquake has awakened us all to what's important, and it's their purpose now to help. And I responded, they're heroes. These two are heroes. What are their names? And he said, their names don't matter. What matters is the legacy that they're passing on, and the legacy of their mother and their father. Their mother was a nurse, their father was a teacher. And so we flew over this destroyed village, and then we landed 2,000 feet up on the mountainside. Our mission was recon only, just to see what the destruction was and to put that village on a map, on a GPS map for the next day. When we landed, the two young girls immediately went to work, and they started asking the questions that they were supposed to ask. How many lives were lost? How many were injured? Do you have food? Do you have water? And an elderly looking woman came up to the young girls and said, my husband is trapped down in the village 2,000 feet below. He's been hit by rockfall. He's paralyzed. Can you save him? Knowing what had just happened to these two girls with their mother and father and brother being killed 48 hours before, and here they were helping. I tried to convince the pilot to let me go down to get him. And the woman had told us he was only 15 minutes downhill. And so I convinced the pilot to let me go get him. And the pilot gave me 1 hour's time before we had to take off, a hard stop of 1 hour. And so I and another started running down the mountainside, and it wasn't 15 minutes. It was about 45 minutes before we got him. And he was paralyzed. He was trapped. And I knew immediately that getting back for that hard stop in 1 hour was going to be impossible. I picked him up in a fireman's carry and started carrying him. His weight was incredibly oppressive, especially at 13,000 feet. He probably weighed maybe 130 to 140 pounds. But it was crushing weight. It was hot. It was humid. His breath was on my neck. It was suffocating. And, by the end of 20 or 30 steps, moving up a single track mountain trail at elevation, you're literally exhausted. And then I traded him off to my partner, who was an EMT from San Diego. And he took him about another 20 steps. And then I took him 20 steps. And then the EMT took him 20 steps. And as we started carrying the man up the mountain, people started helping. First, it was 2 people, and then it was 4 people, and then it was 8. And you could literally see the villagers being awakened, almost like the girls were awakened with the earthquake. And they were awakened, and the energy was palpable, and it was going from negative to positive. This mass of people was now carrying this man up the mountain faster and faster. And again, we're at about 13,000 feet. And so you're literally seeing destruction and rebirth going on in this village. The energy of people was too big for me. I couldn't keep up anymore. They were moving too fast. And it was almost like that contrast of the girls singing and crying, because it was a triumph. We were saving this person. And I think that story is so important for humanitarian work and for other work, volunteer work, because sometimes you start an idea, a person starts an idea, and that idea is born, that concept is born, whether it's volunteering or starting a club or a team or even a business. You start that idea yourself, and you put so much energy into it, and it becomes your identity. And then you build a team around it, and that team breathes some air into that concept, and it begins to develop momentum. But as time passes, that momentum increases, and the idea takes a force of its own. And that's where relief turns into self-reliance, because at some point, the disaster organization is going to leave. Everybody can make a difference, and it doesn't take an Olympic medalist. You don't have to be a surgeon. You don't have to be somebody to make a large difference. Ordinary people can make extraordinary impact. You don't have to fly on an airplane to Nepal and carry a man out of a disaster to make an impact. You could volunteer in your community. You could mentor someone. You could teach. You could coach. You could be nice to somebody. It doesn't take much to start that ball of positivity rolling. And that creates a ripple effect. And, our legacy as humans is not to destroy. It's not to fight. It's not to pollute. Our legacy is really to help each other so that everyone around us is better. Everyone around us is more positive. Everyone around us is more whole. And, I think if we all adopt that concept, think about what kind of place this would be.